Hi, I'm Dr. Travis Elliott. And a lot of people seek out help for digestive issues, especially things like irritable bowel syndrome or chronic never been well since syndrome. What does that mean? Well, a patient came in who was never well since taking a trip to South America and getting a parasite. The parasite was treated, but his gut has never been right since. Typically, when you go to a doctor and you complain about IBS or digestive issues, they focus on, understandably, the gut and how the environment of the gut can be made healthier. There are stool tests that do that and look at the rich complexity of the bacteria and how you break down your foods and what your stool looks like. But I find it to be much more helpful to be more comprehensive. And this is brought home over and over and over again in the use of the bioresonance test, because I can ask, how do we better improve the overall flow of the physiology, not just the gut? And what is the priority? In other words, what steps do we take and in what order to address the symptoms of bloating or cramping or chronic diarrhea or heartburn? And quite often, it starts at the brain. That patient who is never well since South America, the first 2 treatments we did had nothing to do with the gut. They were all focused on the nervous system and chronic aspects of his nervous system's ability to stay calm and relaxed so that his parasympathetic or rest and digest part of his nervous system could be active and give his gut the right nervous system signals to be producing stomach acid, to be producing pancreatic secretions and the gallbladder juices and move food through the intestines correctly and have a healthy gut lining. So we did 2 months of nervous system treatments using both homeopathy and herbs. And his digestion actually felt a little bit better, but more than that, his whole body felt more relaxed, better able to sleep. And then the 3rd bioresonance assessment indicated a need to focus more directly on the gut. He was already taking probiotics, so we didn't need to worry about that. But we did focus on improving leaky gut. And I know you've heard of leaky gut, and leaky gut gets tossed around as the underlying cause of X, Y, and Z disease. But what I always want to know is, well, why does somebody have leaky gut? And if the nervous system isn't giving the right tone to the gut lining, then it's going to start to disintegrate and fall apart. 20 minutes after a stroke, the gut can completely fall apart because the nervous system is not giving it the right signal. So for this particular patient, nervous system first, he's got a stronger foundation, and then we gave him gut-based supplements that gave him nutrition and anti-inflammatory compounds that helped him rebuild his gut lining. And his bowel movements were spectacular. That's his report. After the gut treatment, we're cycling back and looking at how the immune system and his gut are interacting, because he also has some autoimmune disease. And so we're not stopping at the elimination of his gut symptoms, his digestive symptoms, but moving on towards really trying to rehab and balance his immune system now that the nervous and gastrointestinal systems are a much stronger foundation. I hope that makes sense. It's a really nuanced and complex untangling that I get to go through with every patient, and it's really rewarding. Thanks for listening.